Bismillahirrahmanirrahim. Welcome again, guys. Welcome back to another video lecture by Kami Microbiologist. How are you, dear viewers? I hope all of you are well and fine. Dear viewers, today in this video we are going to see another lecture that is related to the lipid profile. And all of you better know that lipid profile is the biochemistry related test. So dear viewers, in this video lecture we are going to talk about another lipid profile, that is the VLDL. Okay, here I forgot to write V, but it is actually VLDL, not LDL. So VLDL means a very low density lipoprotein test. So we are going to explain VLDL test in detail. My name is Muhammad Kamil Khan, and you guys watching my channel Kami Microbiologist. So let's start the video. So dear viewers, what we are going to explain in this lecture, first of all we are going to see that what is VLDL, what is VLDL test. Then we are going to see the diagnostic purpose of VLDL test. Then we will see the test procedure. Then we will explain the normal range. We will see the main causes of high VLDL and the treatment of high VLDL. First of all, let's see the introduction, that what is VLDL. VLDL stand for very low density lipoprotein. Okay, it is also called VLDL-C, means very low density lipoprotein cholesterol. Remember guys, this VLDL is mostly synthesized, or we can say prepared, in the liver. Once it is prepared, so then it is circulated into the bloodstream, and in the bloodstream it will take the triglyceride and carry it to the tissue. Then so we can say that VLDL have 80% of triglyceride. Then we have the normal range, so VLDL should be less than 30 mg per deciliter. Okay, so remember, when we calculate the VLDL ratio in the blood, so the test is called as VLDL test, because VLDL test is not normally measured using a machine. Okay, it should be find out by a formula. I will explain it later. Let's see the diagnostic purpose of VLDL. This test is specially recommended to assess the risk of cardiovascular disease. This test is also important to monitor the lipid level in the body, and this test is also important to monitor the metabolic syndrome as well as the liver function. Moreover, this test is also recommended to check the diabetes and high blood pressure disease in the body. Moreover, this test is also recommended to check out the treatment effect, the treatment which we are providing for the TB, for the diabetes, for the cardiovascular disease. Either the treatment is workable or not workable. For that purpose we perform the VLDL test. So remember Fred, the test in most of the laboratory, the VLDL is calculated by a formula. So it means that it cannot be done, or we can say it cannot be measured. But if let's suppose you have an advanced machine, so we can run this test. Okay, so in the most of the laboratory this VLDL is calculated by a formula. So let me explain. This is the formula of VLDL. So VLDL is equal to triglyceride. You have to perform the triglyceride test. Once the value which you get the triglyceride, you will divide it with 5. So this is how to perform or to calculate VLDL test. Now let's see the main causes of high VLDL. Let's suppose if the VLDL get high, so it will cause diabetes and obesity in the body. High VLDL is due to the genetic disease, means if let's suppose if there is one of the person in your family that have high VLDL, so definitely in your family there will be some other people that have high VLDL. So we can say that it is the genetic disease. Due to high VLDL, it can cause chronic liver and kidney disease. High VLDL is also caused by corticosteroid medicine or drugs. Due to high VLDL, it can cause coronary artery disease, and due to a high VLDL, it can also cause atherosclerosis, means the deposition of the fats and cholesterol in the vessels, due to which the vessels are become thin and the blood flow are very less, or we can say blood pressure are get high. Then we have alcohol and smoking. It will also cause the VLDL high. Then if let's suppose we are using the food or eating the food that is rich in carbohydrate and fats, it will also cause the high VLDL. So this is the main cause of high VLDL. If let's suppose the VLDL ratio get high in the body, then what will be the treatment? First, you have to perform daily exercise, you have to stop alcohol and smoking, you have to lose your weight, you have to eat or avoid those food that contain carbohydrate and fats. And if let's suppose your triglyceride value is higher than 500 mg per deciliter, and it is not controlled by these lifestyle, okay, so then you must use niacin and fibrates medicine. If let's suppose you want to control your VLDL, so you must control your diabetes, triglyceride, high triglyceride and blood pressure. It will control your VLDL ratio in the body. So thank you so much for watching. I hope you like this video. Make sure to hit the like button, share this video, and definitely subscribe the channel to get more interesting videos like that. Thank you so much for watching.